Dear María Neira, it is an honor to welcome you to the International ORP Foundation Executive Interview Series 2025. The series highlights global leaders in occupational health and safety, and this year is particularly special as we celebrate the 25th anniversary of the International ORP Foundation. Thank you so much for joining us today.
Thank you, and happy birthday, ORP.
Thank you for these kind words. And before we start, let me take a brief moment to introduce you to our audience. Today, we are privileged to speak with María Neira, a globally respected leader in public health and environmental safety. As Director of Public Health and Environment at the World Health Organization, she has been a driving force in shaping policies that protect both people and the planet. Is everything correct?
Correct.
Excellent. So as we move on, let's give our audience a quick roadmap of what's ahead. We will start by exploring the World Health Organization. Then we will talk tech and take a look at modern technologies. Next, we will explore the intersection of climate change and health. And finally, we will wrap up by discussing the role of collaboration and the 25th anniversary. Great. So are we ready to start?
Ready to start when you are.
Perfect. So let's set the stage by speaking about the World Health Organization. María Neira, your work has been instrumental in highlighting how environmental factors impact global health. Could you please share some of the World Health Organization most impactful recent initiatives in addressing occupational and environmental health risks?
Thank you. Thank you very much for your question. And of course, this is a team work. There are many people involved in WHO on making sure that we have the right policies to influence occupational and environmental risk factors for health. I think probably one of the most relevant is the fact that we have science now behind. We have scientific evidence telling us that if we address the environmental and occupational risk factors, we could reduce by 25% the global burden of diseases, the global number of deaths. And that's something exceptional. This is the message we are trying to pass to all the politicians to convince them that they have a huge responsibility on addressing the environmental risk factors and a great opportunity to contribute to the health of the people, reduce mortality. We are talking about more than 12 million deaths every year related to this exposure to different environmental risk factors for our workers, for our population, and we cannot miss this opportunity. And of course, influencing governments, influencing policies, making sure that we remove lead from gasoline, or we remove lead from paint, or we remove mercury from medical devices, or we have regulations on the level of toxic particles in the air we breathe. I think all of those are fundamental key achievements that, together with many other international organizations, is a collective responsibility to move on it and to obtain great results on protecting people's health and workers' health.
Such a forward-thinking message. It's inspiring to see how the World Health Organization is leading the way. So moving on, let's zoom in on modern technologies. Technological advancements, including artificial intelligence and data analytics, are transforming public health surveillance and environmental monitoring. Therefore, how do you see these innovations shaping the future of occupational health?
Well, definitely the way now that technology is shaping our society cannot be ignored. We need to use this technology in our advantage, and I think we can do it. It's just a question of balancing the artificial intelligence with the human intelligence and putting the two together and use the artificial at our advantage as a society. In terms of data collection, in terms of that data analysis, in terms of even diagnosis at the radiological and others at the hospital level, putting all the information together, mobilizing this information in a way that we will promote more policy recommendations for our citizens is all a great opportunity. We need to make sure that we will not create a technological gap and then penalizing those who have not access to technology, or we need to make sure that this artificial intelligence will create still an opportunity for improving occupational health standards and not the other way around. But as I say, this is not the problem of the artificial intelligence. Will be us as humans and responsible for taking decisions at the government, maybe the ones that we need to make sure that we will use it properly. Thanks to the new technology, we are able now to have digital medicine and reach places where we couldn't reach before. We can, through telemedicine, we can provide advice in very remote areas on techniques that maybe before they were out of reach for many people living there. And this will create yet another important and a strong network among the occupational health specialists and safety to share data, to promote quick solutions. I think it's a fascinating and challenging time, and will create plenty of opportunities, of course, with some risks, but we need to be prepared to address those risks in advance and use this artificial intelligence on a way that the human part will never be lost.
For sure, this really resonates. Technologies have so much potential. And building up on everything we have discussed so far, it's clear that innovation and modern technologies are helping us tackle occupational health challenges in new ways. However, there is another major factor we can't ignore, which is climate change. Rising temperatures, extreme weather events, and changing environmental conditions are creating serious risks for workers. María Neira, as climate change accelerates, what do you see as the most pressing occupational health challenges it presents, and what action should be taken to mitigate them?
Well, certainly climate change is a health crisis, and we need to make sure that first we stop the causes of climate change. And on that, we need the workers, and we need to create opportunities for the workers to work on new different sources of energy, renewables. We need to look at the creation of green jobs that are fit for those populations that are now at risk, and we need to be part of this transformation on creating a healthy and greener society, and stop maybe the reliance on these fossil fuels that are polluting the air we breathe. The risks for our health workers are essentially for the informal sector. Those will be very vulnerable, those who work outside, and rather they work or they will not get any financial contribution, and they have no social protection. And then they need to work under terrible conditions, the high temperatures that will not have any protection on that. I think we saw it on workers around the world still performing their work while the temperatures are going high and high. So this is the big challenge. We need to create places where those workers need to be protected when the temperatures are so high, and maybe changing the working hours, maybe convincing policymakers to do things different. But the real fixing the problem will be on the mitigation of the causes of climate change. We need to make sure that we reduce the causes of climate change, and for that we need a quick transition to clean sources of energy, better planning of our cities and urban spaces, and a more sustainable food system. And all of that will imply workers. You will have workers behind all of that. So mitigation of climate change is fundamental. We need to see workers' movements excuse me, participating in the COPs, in the negotiations, and making sure that their voices are heard. And we need as well the adaptation to climate change, something that is going to happen no matter what. And then we need to make sure that we will protect those workers for these terrible conditions that they will have with high level temperatures, extreme weather events that will affect the most vulnerables, people who will be benefiting from their agricultural production, and then because it was an extreme weather event, they cannot cultivate any longer. Mental health issues for which health workers will be very sensitive as well. And a package of things that, again, we need to focus on the mitigation of the causes, but we need to be prepared as well to address, as international organizations and as governments, to address and have a very strong package of adaptation measures for those workers.
Could not agree more. These are such an urgent topics. So, to tie this all together, tackling climate-related health risks requires global collaboration. So, let's explore the role of it and knowledge sharing. This year, we are excited to celebrate 25 years of the International ORP Foundation in Cartagena de Indias, Colombia. Thus, María Neira, I'm so curious how, in your opinion, events like these are contributing to the global dialogue on health.
Yes, thank you. It's incredible that we are in 2025 and we still need to remind people that protecting our health in the working environment is fundamental. We need to still remind people that we have an important informal sector of workers over there that has no protection. We still need to remind people that if you are exposed to toxic air or chemicals on your working environment, or a very unpleasant from a mental point of view, working in a stressful environment, it's terrible that we are still there. And for many millions around the world, it is still a big challenge. So I think those events are important, of course. This global collaboration, advocacy, making sure that we do not forget to keep this very high on the agenda. And now with the new changes, the new technologies, the new transformations that our societies are going on, more than ever, we need to make sure that people understand that we still need to protect our workers, create the best conditions for them, not only to avoid diseases, but to promote health. We need to create places where our workers, if they want to quit tobacco, and I hope that they will not smoke, but they will have the conditions. Working places where even if you perform a work which is require a very sedentary lifestyle, you will have the opportunity to move to have an active lifestyle as well. And of course, the diet you will follow in your working environment, all of those opportunities are fundamental if we want a healthy society. So I wanted to, again, congratulate you and a big celebration. 25 years is a big achievement, but I'm afraid we still need you there because a lot of work remains to be done.
Thank you so much for your words and for sharing these powerful takeaways. And if I could ask, what opportunities do these gatherings offer in advancing the World Health Organization mission for a healthier and a more sustainable future?
Yeah, for WHO, the working population is an important target. It's there where we can propose safety standards and occupational and safety standards, but as well, as I was saying, opportunities for promoting health, for better and healthy environments, for making sure that there is a social interaction as well, and therefore preventing mental health diseases. And the opportunities are for global cooperation. Clearly, the interaction between an organization like WHO, which is very focused on health, with other international organizations, groups, foundations, is fundamental. It resonates, it joins forces, it creates more movement, it will bring other partners to the table. It will make our argument stronger by having it together. And of course, influencing those who can take decisions that will have an impact on the life of our workers is fundamental. We need our society to be healthy. We need our society to be sustainable. We need our society to be happy. And that requires a strong collaboration. Events like this one, it requires people committed, and it requires as well a lot of advocacy to remind everybody that this is not a finished agenda, this is unfinished agenda and will require a lot of work in front of us.
Absolutely. Bringing people together is so vital. María Neira, this has been an incredibly insightful discussion. Thank you so much for sharing your expertise with us today. And before we close, do you have any final thoughts or advice for our audience?
Well, it has been a pleasure to have this interview. Thanks for inviting me. And I count on all of you because the challenge is huge and your role is fundamental. And I want to wish you the best because your great results will be fundamental results and positive ones for all of us. So all the best because your success will be our success.
What a beautiful way to frame it. Thank you so much. And big thank you to our audience for joining us today. Last but not least, I would like to remind everyone that the 25th anniversary of the International ORP Foundation is just around the corner. Stay safe, stay proactive, and follow our official channels for more inspiring conversations like these. Bye bye.
Bye bye. Thank you. Thank you so much.